So my role is to provide the best treatments for our heart failure patients. And one of the more exciting things that we've seen in the last couple of years is the development of MitraClip, which provides us with some of the best data in terms of long-term survival and keeping patients out of the hospital. At Erlanger, we have a team-based approach which helps us to select the right patients for that procedure. And I've always found it's better to have multiple people putting their heads together rather than just one person. And so our team-based approach involves myself, potentially other imagers, and structural heart to select the right patients for those procedures. And part of that process is that we make sure we've addressed all the potential less invasive needs first. So is the patient on the right medicines? Are there other potential avenues such as interventions on heart arteries that we can do? Other procedures like pacemakers or resynchronization to make sure we're doing the least invasive things first to optimize the patient. And then when we've established who's a good candidate, we'll do the imaging procedures where we look at the valve to make sure we have a good approach to fix it. And then I'll see that patient in the clinic with Dr. Coilwright, and we'll explain the procedure, make sure they understand it, and then the two of us will be performing the procedure together. So the patient will know both operators in the room and have had experience with us in a comfort level, which I think is a benefit. Prior to the procedure, we do something called a transesophageal echocardiogram, and what that involves is having anesthesia put the patient to sleep so that we can get really detailed pictures of the mitral valve. And part of that is because pictures from the outside only penetrate a certain depth, and the mitral valve is actually the most posterior structure in the heart. So by doing that, we're able to get very close-up, detailed images of the valve, figure out what the actual problem is, and then plan together so that when we go in, we have a detailed plan and approach that we want to take beforehand. And then the day of the case, I'll help guide Dr. Coilwright in the procedure using the same technology, the transesophageal echocardiogram, so she'll know where she is, where the clip is, how the leak is improved, so that we can deploy it when we're happy with the result.